Hey guys, Justin here, first year APU DPT student. So as mentor evals are coming up and we are coming to the culmination of our first year, it's going to be a cumulative mentor evaluation, meaning we're going to get possibly tested on anything that we've learned so far. So that's lumbar, hip, knee, ankle, cervical, and thoracic spine. And as you can imagine, things could get really jumbled up in here on okay, so I know it's that diagnosis, but what type of tests do I really need to look for? What are my key findings that I really need to look out for? So this app, the CPR app by Physio-U, has really helped me to organize and categorize everything, so it just stays really just like in files, in folders. It's not like a big cluster of mumbo jumbo. So for example, here I have it up right now. I have the cervical spine app here, and we're going to go to clinical pattern recognition. We're going to go to all diagnoses, and let's say I go, okay, so radiculopathy, what are the things that I need to look for in my physical exam that can rule in radiculopathy? So radiculopathy has what's called the cluster, right? So you go to the cluster and it's all right here. So you have your active range of motion of the head, you have your upper neurodynamic test, your Sperling's test, your distraction test, and if all these are positive, then you have a high likelihood that this patient that you're treating does have radiculopathy. So if you look and you're like, oh shoot, what was the neurodynamic test? There's the median there, there's the ulnar nerve, I don't know if they're supposed to be looking away from me or towards me. And you just click here, press play.
The patient supine, take the involved arm, block the scapula from elevating any further while using your femur to block the humerus. Maximally externally rotate the shoulder while extending the wrist and abducting and extending the thumb by moving two joints away.
And there you go, it's that simple. With all the diagnoses of the lumbar, all those joints that we've gone over, I can literally go into these apps and there is a location for all of them. So we have your neck, your shoulder, elbow, wrist, lumbar, hip, knee, ankle, foot, and Physio-U also comes out with the gait, cardiopulm, and ROM MMT app here. So it's basically, they are equipping you with all these apps to just help you be successful so that it's not a cluster, it's not just foggy and you're trying to dig oh my gosh, what were the tests? Go to the app, click what you need to find, it's all right there.